Hi everyone, we are excited to have you here in today's fun-filled learning session at YOLO. Here is a quick look at how you can submit your work after the class. As a first step, go to live.yolo.com. You can use any browser to access this site. On this page, you will see a list of all our classes. Scroll down and you can see the Submit Your Work button. And then you will see a list of the classes that you've last attended, which could, for example, show the dance or craft or science experiment classes you've attended recently. Next, it will show you the list of children whose names are registered in this mobile number. Choose your name from this list to submit your work. For instance, if you are Satvik Kumar, choose that name. And then choose the class for which you would like to make your submission. For example, if you've attended the New Year's Masquerade Party session and you'd like to make the submission for this class, click on the Submit Your Work button below that. And then upload the photo you've taken. Choose the image from your phone and click Submit. You can scroll down and view all your past submissions and see how many of your friends or peers have liked your work. You can also see others' work and like their work to inspire your friends. If you want to showcase your work on social media, that too is very simple. Click on Share, copy the link and post it on Instagram or Facebook or any other platform of your choice. Just a tiny reminder, your submission looks a lot better if you could click a photo in the landscape mode rather than the portrait mode. Do not forget to tag us at YOLO_app. I'm eagerly looking forward to all your submissions right after this class.
Hey there kids, how are you doing? Welcome back to today's class. I hope you had a look at the submission video and it made sense to you on how to go ahead and make all of the submissions for all of the classes that you have been going ahead and attending. So today is the second class of the COVID-19 or coronavirus informative GK class that I have been going ahead and conducting for you guys. Today we're going to go ahead and discuss about something different. But before we go ahead and get started off with everything, I want to go ahead and give you sort of like an idea of the certificate program as well as the feedback program. Now, the certificate program is a very, very simple program wherein if you go ahead and attend all of the classes of any particular course and go ahead and make all of the submissions for that particular course, then you will go ahead and get a certificate at the end of every course. Now, why is this important? It is very, very important because it will sort of give you an identification or a proof to give to people as to what you have learned or the skills that you have developed. So whether it's your teachers, whether it's your peers, whoever it is tomorrow, you can go ahead and provide that and tell them that, look, this is what I have learned, this is what I have done, so on and so forth. So it'll be really, really helpful and useful. So make sure you go ahead and take part of this program and attend all of your classes and make all of your submissions. Apart from that, we have another program going on which is called the feedback program. Now the feedback program as well is a very, very fun program wherein if you go ahead and get selected as that part of the top 10 when you make your submission, if you get selected as part of the top 10, then I will be giving you some personalized feedback. Now the feedback can be two ways. Either one, it can be a critical feedback, or two, it could be a positive feedback. Now what do I mean by critical feedback? By critical feedback, I mean that it could be feedback in which I identify a few flaws or a few mistakes or a few things that probably you can go ahead and improve on. What do I mean by positive feedback? Positive feedback are a feedback form, like, feedback information in which I'm going to give you an idea of what you're already good at and how you can go ahead and progress with it and how you can continue working on it and, you can grow your skill on those lines. So that is the feedback program. So now let's go ahead and start talking about what we're going to be learning today. In today's class, what we're going to do is we're going to go ahead and take our discussion about COVID-19 or coronavirus, whatever you want to call it, a little bit further. So let's talk about, the concept of what we're going to be doing today. So now today's class, like I said, talking about coronavirus, we want to move forward to talking about things like what happened all around the world. In the last class, we spoke about how coronavirus actually moved, all around the world. We spoke about how, it reached different parts of the world. But after that, we didn't discuss about how it actually affected people individually, how it affected healthcare systems, and how it affected the economies in general. So that is what we're going to be focusing on today. Now, in today's class, we're going to go ahead and do a little bit of a different way of learning, which is I am going to be going ahead and drawing everything out with you. But instead of going ahead and doing it with colored sketch pens or color pencils or anything on those lines, I'm just going to be doing a black and white illustration with you, or a black and white doodle with you like this. And I want to go ahead and get you to go ahead and color it in as part of your submission. So the coloring bit or the adding color bit is completely up to you. All I am going to be doing is I'm going to be focusing mainly on just getting you to do the drawing part of it. So just something added bonus, something, fun and exciting for you to go ahead and do something different as compared to all of the classes that we normally have. So let's start off with all of the materials you need, and then we can start our discussion. So the first thing that you obviously need as part of any class is going to be a sheet of paper. So here I have an A4 size sheet of paper, as you can see. And the second thing that you need for today's class is going to be a set of sketch pens. Here we're just going to be using a black color sketch pen for our entire drawing, and hence I'm not showing it to you right now. As for the sheet of paper, you can go ahead and take a journal book, a drawing book, a single A4 size sheet of paper, and any unruled sheet of paper, any of that would do. And for the drawing, I'm just going ahead and taking a black marker or sketch pen. If you feel you're going to be a little uncomfortable directly going ahead and using an A4 size sheet of paper or a marker, then you can go ahead and, if you're uncomfortable using a marker directly, like a black sketch pen, then you can definitely go ahead and draw the whole thing with pencil, later outline it and then color it in. But remember that after the class, you will have to go ahead and color it. So try to make it as neat as possible so that the coloring process that you do later on before you submit your drawing is simple and easy. So just make sure of that. So let's talk about a little bit about the whole concept that we're going to be talking about before we move on. So like I told you in the last class, COVID-19 or coronavirus basically became an official pandemic in 2019, 31st December, which is basically 2020, Jan 1st. What happened slowly was, like I mentioned, the coronavirus or the virus started spreading amongst people because people didn't really know that the pandemic had hit, and the medical professionals, all healthcare workers weren't like prepared for something like this to happen at this point of time. So what started happening was a lot of people started getting infected. Both could be asymptomatic and symptomatic, which again we discussed in the last class, and this started going ahead and spreading all over the world. Like in the last year, every country pretty much went through lockdown, wherein every country basically stop the movement of people from one place to another. So that was one of the major effects of coronavirus that happened internationally, wherein people stopped moving around between places, because the more people traveled, the more the chance of infection and the more chance of spreading. So one thing that happened very commonly among all countries was the concept of a lockdown. Apart from that happened very very unanimously between all of the countries, was that every country shut their borders between other countries so as to not spread the virus more and more between countries. So that was another thing that happened. Now, apart from these two things that happened sort of internationally amongst all the states, something that happened very commonly in the route of each place was very very important, and that's what I want to go ahead and discuss today. I've basically divided it into three categories. One is personal health, that is what happened to individuals and what happened to people, how people lived and things like that. So individual living and individual health is the first thing that I want to talk about, how that got affected for each and everyone around us in the world. The second thing that I do want to discuss is what happened to the healthcare systems all around the world, that is what happened to our medical practitioners, healthcare workers, etc. What happened in terms of that. And finally, I want to go ahead and talk to you about the economies that exist around the world. Now here I'm not going to talk about individual economies. I'm going to go ahead and talk about collectively what happened, the major signs or major things that everybody started seeing. So let's now start off with individual health. So, starting off with individual health, the first thing that I want to go ahead and talk about is, people falling sick. So, here I'm going to go ahead and draw a thermometer. I'm drawing a curve like this, and then drawing two lines coming out like so. Very, very simple. Drawing a dot and then drawing a place where you can see the temperature. So, like you all may know, temperature checking has become such a common thing all around the world. Now, there are many aspects in which that you can understand this. One is at home, if people are falling sick, it's something that everybody becomes so watchful of. That is, if we have a fever, if we do not have the fever, why do we have a fever? What are the corresponding, reasons of having a fever? So a lot of us still can fall sick in coronavirus, during the pandemic, but it could be because of other reasons. So something that everybody's been very watchful about is how individual health is. So how people are falling sick, what their temperatures look like, not having very high temperatures. And something that is a very common sign when you're going out in public is people check your temperature wherever you go. So if you're going to a supermarket, if you're going to watch a movie, if you're going out to anywhere, any store, anything you're going to, people will go ahead and identify and figure out what your health or temperature looks like, because it's a good indicator. Now, moving on to the next thing that happened as part of individual lives is the concept of wearing a mask. So you can see I'm drawing two curves with two lines, and then I'm drawing lines in the center. This is like a surgical mask, and I'm drawing two curves like so, which are the ear loops. Now, wearing mask became very important as part of individual health because it stopped the spreading of coronavirus. People started wearing masks in order to, block the virus from our nose and mouth spreading. So whether if someone has coronavirus, it will not spread. As well, if someone has coronavirus and is coughing at you, if you are wearing a mask, then you will be protected. So that is something that everybody incorporated as part of their individual lives. Everybody made it a must that when they go out, they definitely have a mask on. A lot of patients, even when they were in home isolation, do wear masks so that they don't infect their family members. So that is something that we live with today, and what an impact it has on us. All of us right now wear masks. Some of us don't like wearing our masks, but still it is very important. So that was the second thing that happened as part of the change in our individual lives in terms of COVID-19 or coronavirus. Now, the third thing that basically ended up happening was the concept of, using sanitizers, maintaining hygiene. So here I'm going ahead and drawing a sanitizer bottle. You can see very easy. Just going ahead and drawing this. Make sure you're drawing all of this with me while I am talking. That's why I'm giving you that extra time while I am explaining. So make sure you're drawing it. So the concept of sanitizers came over, and it has completely taken over our lives. So coronavirus does die with 99%, over 70% of alcohol when rubbed on. And some places that we do definitely go ahead and put on sanitizer is obviously our hands. We clean our hands with sanitizer, as well as if we receive any cartons, boxes, any elevators, lifts, norms here and there, wherever we are walking, we tend to sanitize everything so that the infection doesn't spread more and more and doesn't sit on places and then affect all of us. So we don't want the virus to affect us. So that's something that became very important. Personal hygiene of people in terms of sanitizing, in terms of even bathing, people started being very cautious about this. So that was the other thing that started happening. The next thing that was very, very common amongst people and individual health was the concept of social distancing. Now, this I think everybody knows and has got affected by in some or the other way. So, if you do meet someone outside, you do know that you have to keep a 6 feet distance from them. Now, the reason basically was that if you cough or talk, or if you do have the virus in you, then the spreading of the virus, reduces when you're maintaining a 6 feet distance between people. And hence, it became very, very, very important to go ahead and start maintaining distance from people, because you don't really know whether someone has coronavirus or not. And obviously, you can't blame people for, getting infected. It's something that is just suddenly happening and nobody is prepared for. Now, this obviously did affect a lot of people, because people couldn't go to offices, people couldn't do a lot of things. So something that became very, very evident with this thing, with the concept of social distancing, was that you couldn't meet people, you couldn't meet family, you couldn't travel, you couldn't do all of that. So that was a big impact on our social lives specifically. Now, apart from that, one thing that was very, very commonly seen for all of us all around the world when the pandemic hit, or the virus basically came in, was the concept of people falling sick. Now, obviously, it is a medical health emergency, so the concept of people falling sick is something that is inevitable when it comes to such a situation. So, hence, here I'm going ahead and drawing a pair of lungs, because mostly people who were falling sick were having lung issues. They were facing things like pneumonia, and they were having breathing difficulties, loss of taste, loss of smell, all of that. So all of our respiratory issues, everything related to our lungs, was something that was being very, very highly affected when it came to the pandemic and coronavirus itself. So apart from basic health, the people who were actually falling sick individually were having many, many issues. Unfortunately, there were also a lot of people dying because they could not take care of themselves, or their bodies could not handle the virus itself, which is a very, very sad thing. But that is something that individuals did face. A lot of losses everybody faced, and families did have to face. So on the individual level, this was another thing that totally existed. Apart from that, one thing that existed all year, all world around, was the concept, like I mentioned, of a lockdown, wherein people started staying at home and needed to start staying at home. Now, the reason why people needed to start staying at home was because, again, we wanted to reduce the concept of infection. We wanted to reduce the number of people being affected. So people started staying at home and started doing all of their activities from home. One thing that did exist was that the increase of work from home, work from wherever you lived, increased completely. Now, here I've gone ahead and drawn a building. Now, this I intend it to be workspace building, that is an office or a school or anything that you want to take it as. People were not allowed to leave their houses to travel, etc., obviously, but even essential things such as working as well as going to school was stopped. A lot of you might be studying from home right now, and that is also due to the pandemic specifically, because work from home or studying from home and everything became very, very important as part of our individual lives because of the pandemic. Apart from that, one thing that became very, very common to everybody was the concept of building their immunity. It is a very, very vital that everybody started building their immunity, so that even if they did get infected with the virus, because nobody knows if you can get infected or not, was that if you had a stronger immunity and you did fall sick, then at least you would be able to heal as fast as possible. So that is something that became a very, very big vital importance, that people who did get affected should have good immunity systems. So people started working towards individual health and building of immunity. So reduction of unhealthy foods, increase in breathing exercises, increase of taking care of our respiratory system became very, very important to everybody. Now, here we've gone ahead and discussed everything about individual health. Now, let's talk a little bit about the healthcare system that we have. Now, what happened to the healthcare systems? So here I'm going to be, identifying the healthcare system as a plus. This is the medical plus that we have, the doctors plus that we have. So that's what I'm going ahead and drawing here. So the first thing is, what I'm going to do is I'm going to go ahead and draw a building. Now, this is basically a hospital building that I want to go ahead and draw. So take your time in doing all of the drawings. You don't have to draw it exactly the way I draw it. If you can, that's fantastic. If you can't, that's also all right. No issues whatsoever. Okay, so what happened to our hospitals? Now, obviously, with the pandemic being hit, we aren't really prepared to have a lot of people falling sick. We do have hospitals around us, we do have doctors, we do have nurses, we do have staff to take care of hospitals, but are we prepared for a full-blown pandemic where a lot of people are falling sick? Not necessarily. So what happened was that hospitals started being like fully filled up and a lot of people started going to hospitals. Now, because of that, obviously all of the healthcare practitioners started getting affected quite a bit. A lot of people started getting infected by COVID-19. Other people had to keep wearing PPE kits. They couldn't meet their families for very, very long times. They were working overtime to help individuals and citizens, whoever were being affected by the pandemic. Something that was very commonly seen throughout the pandemic and is seen even right now is the reduction of beds that we see. So a hospital basically has a number of beds for infected people to be in, but as the pandemic rose, the number of beds that were available completely reduced. There were not many beds available. Some of these beds were ICU beds, some of these beds were ventilator beds. Now, ICU beds is basically beds where normally they do take care of people, but they take special care of people in the ICU ward. And apart from that, you also have ventilators. So since I mentioned that this is a respiratory disease, right? It's all related to breathing. A lot of individuals need artificial oxygen or ventilators to breathe for them. So a lot of the times people and beds, etc., weren't available because of the load of patients that were there, and it was a very unfortunate thing for the whole world to face in terms of the healthcare system. The last thing that did start through the pandemic was probably one positive, was that the healthcare industry or the healthcare system started looking to find a vaccine and started doing hit and trials of medications that would work with coronavirus. There are different medicines that have finally been identified to help patients, but it will not cure the virus. So in terms of help, at least that was found and was made available. But apart from that, the vaccine now has come out. People started doing research of the vaccine. At that point of time, it was one of the effects for the healthcare system, wherein they needed to start figuring out a solution to the problem that we had in hand. Now, the last thing that I do want to discuss, and the last category that we're going to be discussing in today's class that was affected, was the economy. Now, the economy obviously plays a very minute part in the pandemic because of how people are falling sick and how people are unwell and how the healthcare systems are being affected. But the economy is where livelihood and survival comes from, and hence it cannot be ignored, and we need to talk about it. So let's draw a note, a rupee note right here. I'm drawing a very simple rupee note right here, and I'm going to talk about now the ways that it got affected. So firstly was that one big thing that did happen was in terms of work and livelihood was that people couldn't go to work, like I was telling you. Now, since people could not go to work, a lot of people got affected in terms of how much they could do. So productivity in terms of work really reduced because of the pandemic. This led to a lot of people losing their jobs as well, because there was a lot lot of work that didn't need to be done anymore, and people wanted to work as minimal as possible. So you can see a lot of people started losing their jobs because people couldn't go to work, so a lot of work wasn't done or needed to be done. People started working from home, so a lot of people started losing their jobs. Now what happens when people start going to work and people start losing their jobs also is that the value of currency reduces, or the economy falls in general. So what happens is, obviously there is a supply and demand schedule that works. This you'll probably learn later in economics, in your later grades, but basically the concept of an economy is in relation to supply and demand. And there was a big reduction on the supply and demand of normal products, and hence there was a fall in buying and selling in the economy, which was very, very sad because a lot of people's livelihood is based off of the economy. So that's one other factor in which everybody was affected. Now, what we've done today is we've gone ahead and discussed all of these essential and vital things in relation to how the world collectively was affected. And we divided it into 3 categories. The category 1 was basically individual life. The second category was the healthcare systems. And the last category was the economy itself. So I hope you understood and got an idea of how COVID-19 or coronavirus basically affected people individually, how they affected the healthcare system, and finally how they affected the economy. Now in tomorrow's class, we're going to be talking about a little bit about all of this, but mostly in relation to India. Now we do live in India and we do face the reality that we are in today. And to understand what situation we are in, we need to understand how coronavirus reached India, when it came to India, and how our Indian government or Indian states were handling it. So that is what we're going to focus on in tomorrow's class. Now in today's drawing, like you saw, everything was black and white. None of it had colors. It was a simple arrow doodles, poster illustration of everything that we learned today. For your submission, I want you to go ahead and color it. I do not want a black and white piece like how mine was. I want you to go ahead and color it and then submit it. And make sure to remember that to attend all of your classes and make all of your submission to get the certificate at the end of the course. Another thing, very, very important, I'm going to be giving personalized feedback, so don't miss out on that, right? I want you to definitely go ahead and get that. So I hope you enjoyed today's class, and I will see you tomorrow while we discuss where we discuss everything in relation to COVID-19 or coronavirus in India. So I'll see you guys tomorrow. Bye-bye. Have a look at the submission video if you haven't already. Bye.
Hi everyone, we are excited to have you here in today's fun-filled learning session at YOLO. Here is a quick look at how you can submit your work after the class. As a first step, go to live.yolo.com. You can use any browser to access this site. On this page, you will see a list of all our classes. Scroll down and you can see the Submit Your Work button. And then you will see a list of the classes that you've last attended, which could, for example, show the dance or craft or science experiment classes you've attended recently. Next, it will show you the list of children whose names are registered in this mobile number. Choose your name from this list to submit your work. For instance, if you are Satvik Kumar, choose that name. And then choose the class for which you would like to make your submission. For example, if you've attended the New Year's Masquerade Party session and you'd like to make the submission for this class, click on the Submit Your Work button below that. And then upload the photo you've taken. Choose the image from your phone and click Submit. You can scroll down and view all your past submissions and see how many of your friends or peers have liked your work. You can also see others' work and like their work to inspire your friends. If you want to showcase your work on social media, that too is very simple. Click on Share, copy the link and post it on Instagram or Facebook or any other platform of your choice. Just a tiny reminder, Your submission looks a lot better if you could click a photo in the landscape mode rather than the portrait mode. Do not forget to tag us at YOLO_app. I'm eagerly looking forward to all your submissions.